Good morning, APOSI peeps. Welcome to our Wellness Wednesday webinar. For today's topic, we have psoriasis. I am Mary Claudine Casabuena, your speaker for today.
For today's discussion outline, we have the overview of psoriasis, the symptoms, types, causes, risk factors, prevention, and the treatment. So what is psoriasis? It is a chronic but not contagious disease. It causes red, itchy, scaly patches, most commonly on the knees, elbows, trunk, and scalp. So it is the immune system that mistakenly attacks the healthy skin as if it were fighting an infection. That's why a certain person has a psoriasis. So it is a common long-term chronic disease with no cure. So the making of new cells is normally every 4 weeks. But in person with psoriasis, it takes every few days. The word psoriasis derived from the Greek word psora, meaning itching. So these are the following symptoms of psoriasis. We have red patches of skin covered with thick silvery scales. It is not all over the body naman siya makikita. It only has a certain part or areas in the body na merong red patches. Also, it has small scaling spots commonly seen in children. So para siyang pimples lang. Then it has also a dry, cracked skin, may bleed or itch. Another one, itching or burning or soreness on the affected area. Then nagkakaroon din ng thickened, pitted or ridged nails. And then it has a swollen and stiff joints. We have different types of psoriasis. First, we're going to discuss the plaque psoriasis. It is the most common type. It causes raised inflamed red skin covered with silvery white scales. Usually nakikita ito sa elbows, knees, sa scalp at saka sa lower back. Guttate psoriasis naman, it starts in children and young adults. It has a pink red spots dun sa skin that looks like a pimple pero hindi siya pimple. Nakikita ito sa areas ng trunk, upper arms, eye, and scalp. We also have inverse psoriasis. Usually, nakikita ito sa armpits, groin, under the breasts, skin folds, around the genitals, and buttocks. This is a patch also, pero it looks like bright red, smooth siya and shiny, but it don't have scales. It gets worse when sweating and once it is being rubbed. Then another one, we have also pustular psoriasis. It commonly appears in adults. It has a, as what you can see, it has a pus field and it is surrounded by a red dun sa skin mismo. So it looks infectious pero hindi siya infectious. So when this happened, it is already very serious and you need to have a doctor consultation for this. We also have erythrodermic psoriasis. It is least common, but it is very serious. So it affects mostly all over the body and it causes widespread. So it looks like para siyang na sunburn yung skin and then it is very, very red. If this appear, it means to say that psoriasis is already hard to control. May tinatawag din tayong nail psoriasis. So nagkakaroon tayo ng nail changes dun sa nail bed. So commonly to people with psoriatic arthritis which affects their joints. And lastly, we have the psoriatic arthritis. This is what affects some people who have psoriasis. So the joint problem can sometimes begin before pa lumabas yung mga skin patches. So what are the causes and its triggering factors? The main cause of this is immune system and hereditary. So malaki yung chances if meron kayo sa family na merong psoriasis na. So for the triggering factor, we have stress. It is the most common triggering factor to psoriasis. As well as if you have psoriasis, it causes also stress to people. Then we have also injury to the skin. It appears in the areas with injury. So this is the result of what we call the Kebnar phenomenon, which states that scratches, sunburn, and bug bites can trigger psoriasis to flare. We also have illness. Anything that affect the immune system can trigger psoriasis. That's why we need to take care of our immune system, but by eating healthy food and taking multivitamins. Of course, weather is also a triggering factor. Cold weather causes flare due to less sunlight and humidity. While warm weather naman can often improve psoriasis because of natural sunlight and higher humidity. Food also triggers psoriasis like alcohol and as well as environment. These are the risk factors. If you have a family history of psoriasis, then for those who have HIV because they are immunocompromised, stress again, and then obesity and smoking. These are the following prevention. So we need to have reduced stress. So how can we do it? We have to have a stress management. Then we have to avoid infection. We should be hygienic and keep your hands clean always by washing it frequently. Then we have to avoid certain medications. These medications are usually given to psychiatric patients. We have to eat healthy diet to boost our immune system, take multivitamins and vitamin C as well. And we have, as much as possible, we have to prevent injuries. For the treatments of psoriasis, we have creams and lotions. These are for the first line of psoriasis defense. So it is also over the counter or with doctor's prescription. So usually, cream, ointment, or lotion, nilalagay siya dun directly sa affected area. Oral medications naman, it can help reduce inflammation and hold back skin cells to produce very frequently. We also have light treatments. So we are using here the UV rays that can help heal, and it can be done sa clinic ng doctor. If you want it to do it at home, so you have to have a device to use. Then lastly, we have the biologics. These are the drugs that are injected and infused through IV or pinapadaan siya sa vein ng patient. So these treatment options, yung creams and lotion, it is only for mild cases. Then for the moderate, we have the light treatment or the phototherapy. For severe cases, we have the oral medications and biologics.
That ends my presentation. Always remember that psoriasis is not curable, it is not contagious, but it is controllable. If you have any questions, clarifications, and suggestions, feel free to reach our clinic team. Thank you for your time and have a great day. Bye.